Hello, I'm Peter Murray, and today I'm joined by David Weatherhead. David is a design principal at HOK, architectural practice, and we're going to talk about what design or how design can help as we come out of lockdown. So, David, I mean, it seems that things like physical distancing will continue to be a requirement for some time to come. How can we temporarily design our infrastructure, office buildings, public space, shops, restaurants, to be able to operate in a period when we're 2 meter distancing?
Oh, hi, Peter. I think that's the question everyone's kind of asking themselves. I think ultimately it's going to have to be some sort of gradual approach to getting people back to work. I think obviously things like phasing of staffs can be very important. I also wonder whether there'll be kind of a natural drop in numbers of people going back just because of the success that people have found with home working. I think that'll all be linked to kind of the commercial viability that companies will look to their premises, and maybe people will really start thinking is the value of their rent the same as it was previous. Obviously, there'll be a tendency for smaller numbers of people with meetings, which potentially make these things more efficient, right? And I think one thing that will change will people who are unwell. I think they just definitely won't go to work. I think previously, we kind of, as long as we can get out of bed, I think people kind of got to work. But interesting that I find it fascinating, the 2 meter distance, because I think we think of it as 2 meters, but if we actually think about what that means in terms of a radius around each person, that's 12 square meters of area. Obviously, it's not two-dimensional space. That's 24 cubic meters, of space. And I think really one of our biggest challenges is going to be our transport, how we get to work. If we think of a Route Master bus, they take 80 people and they're about 45 square meters in area. That means that each person in a Route Master bus gets about 0.5 square meters. So you can imagine that could mean there's only 6 people a bus, if we really kind of restrict. And if we look at the tube as well, we're looking at over 1,000 people on a London tube. Rush hour, that's less than half a square meter a person. So there's going to be some huge challenges just getting to work to start with. So I think there'll be a surge in cycle use, obviously a surge in people walking, but I think also there could be a surge in car use. I think a lot of people see their car as a safe capsule to get to work, and I think them two things don't necessarily go hand in hand. But really, I think we're all going to feel like we've got a duty with our carbon footprint consciousness, so less air travel. In terms of the buildings we have, I think we've got to rethink the way that our buildings are adaptable. We have 2 million square meters of unused office space in London, and we've really got to ask the question why we've got that office space that's unused. And one of them could be because a lot of offices are deep plan and therefore inherently difficult to change use. But if we really think about designing buildings that can easily be adaptable, things like natural ventilation, which I think is going to be something we have to start thinking about when going back, that could be a win-win for the environment as well. Are we looking at in the future of adaptable working places, of smaller buildings, ones that are easier to convert? In terms of the streets, I think there's an amazing opportunity to rethink our streets, to really declutter what currently kind of inhibits public flow. Obviously, with a healthy streets approach, we'll be looking to be pro-cycling, pro-pedestrian, but ultimately making it really safe. I think there's an amazing opportunity also to incorporate nature. And I think with this increasing of car use and potentially cycle use, we really need to kind of focus on making our streets safe. I understand obviously in Budapest and Berlin, there's temporary cycle lanes being incorporated. There's been a kind of widening of pavements already discussed in places like Hackney. Rethinking what our street experience is going to be to allow more people more space, but also allow people to meet, I think is going to be really important. Sadly, I think retail is going to continue to suffer badly. But I think it's an opportunity for us to say, well, what do we want from our street extension? These spaces that kind of on the sides of our streets, what really do we want them to be? And do we want to think about incorporating nature as a way to not only help social distancing, but also allow segregation of cars and pedestrians? You know, I was kind of thinking it's a strange thing, but really we're going to have a shock to our biodiversity, right? We're in a time, you know, springtime is an amazing time to, you know, to witness kind of everything coming back to life. But, you know, we've got these spring animals that are going to be emerging into something really odd, right? There's no people around. And that's going to give them a false sense of security. So I really think we've got to consider our re-impact on our environments. And you know, in all of that, something that hasn't gone away, and I know lots of people have been talking about it, and one thing at HOK we're signed up to is the 2030 Climate Challenge. We need to really make sure that our focus in all of this is to make sure that, you know, the place that we live in is a better place, and, you know, looking at how we can meet net zero better targets by 2030 is something that we're taking very seriously. Just in terms of what that means for places like stadiums. So, you know, if we look at a general stadium, you're looking at about half a square metre a person. As I said earlier, if it's 12 square metres that each person's going to need, then you're going to have Wembley full at 3,000 people. So, you know, are we thinking or looking at smaller capacity but more numerous occasions? Or are we looking at things like seating design and looking almost back to the future to kind of these kind of cubicle style seating where you can actually get more people closer together by bringing the sides up of areas? Obviously a huge amount of things to kind of look at there. Obviously things like staggered entrance and exit, maybe almost look at airport style ticket prices as well. And also, you know, within restaurants, I'm sure we can all expect things like higher hygiene standards going forward. One of the big wins, though, I think, is things like esports. We've seen kind of an interesting change to our, you know, normal background activities of having a range of sporting activities, and all of the players and drivers, for instance, Formula One, getting into kind of Formula One virtual Grand Prix. And looking at people like ESPN who like held a marathon of sports. Within all of that, video game usage is up 75%. You know, so I think although social distancing will become something that I'm sure we can adapt towards, and there'll be strategies, I think we should, as designers, look at it as an opportunity to rethink our streets, our environments, and think about ways where we're not creating temporary waste. You know, I think that's going to be the worst thing, is by trying to retrofit lots of things and try to come up with short-term answers, we don't get locked into a throwaway culture of designing for the now and not thinking about the future.
But presumably, in a firm like HOK, lots of projects being carried out at the moment, designing buildings which will be built in 3, 4, 5 years' time. So you are having to accommodate some of the changes which you think might happen, presumably.
That's right. And Peter, I think there's kind of like 3 areas here that we've kind of all experienced. And I think the first one is our values have slightly shifted. That affects our behavior, and ultimately that should affect our surroundings. You know, if we kind of look at our values, I think what we want to do is we kind of reassess what's important to us. Health and well-being is clearly still extremely important, as is the NHS, and as is, you know, the drive now. You know, although we can only exercise one day an hour, kind of one time a day, I think people are doing more exercise. It's almost like one of them things, if you know you can't have it, you do more. I think our friendship and the family and our support network is kind of been highlighted as always important. But we've kind of really analysed our time breakdown. You know, the commuting time versus family time, I think is been something that a lot of people have been soul searching for. The other is our environment, you know, our home life and you know, our children. And lastly, on our values, our minds. I think, you know, learning and schooling, I think, is something that we've had to embrace. All of that changes our behaviour. And I think it would be awkward to get back to normal after living under these rules, right? I think the success of online meetings, they've become kind of normal now. You know, and HOK is kind of a multi-office global company. And I think an advantage is for us is it actually brings us closer together because distance was separating us. So actually we can probably have more diverse teams on projects. And we've really got to think about our high environmental consideration, transport, waste and time. And, you know, to be honest, I think we will expect change to happen. And all of that, coming back to your question, changes our surroundings, right? So I think we'll have a drive for a clean environment. I think what we'll have is a real attitude towards a paperless office. And you know, now we mean it, you know, as a way to make sure that we can minimize our spread of bacteria. We will, you know, continue with thinking about adaptable workplace, but really hot desking, I think, is going to be a fundamental to not just making sure we don't have less clutter in offices, but also really kind of adjusting to that separation distancing within our workspaces. And, you know, I think we've got to think about the material specification for some of the buildings. You know, infection control is something which has always been paramount in healthcare design. And I think really we've got to have a real kind of hard look at some of the materials being specifying. And also maybe it's less touch technology, you know, things that we don't have to necessarily touch to operate. Within all of that, I think some of the wins are going to be maybe a look back to kind of simplistic approaches for things like ventilation. Here in Shanghai, they've actually shut their air conditioning off. And, you know, I think we've got to wait to see what happens in the summer over there. But, you know, I think, you know, high natural ventilation is going to help not just the environment, but also infection control. Within office design considerations, I think we've seen a trend to kind of make the office more like the home. Now spend 6 weeks working from home, you know, things are good and things are bad. And we might want something different when we return to like centralized work. I think there'll be a drive for social space. You know, have we missed that kind of non-work chit chat? And then it comes down to things like, you know, do we want to really change our approach to having a community of workers and, you know, sharing facilities within other practices such as 3D printers? You know, and you touched on, you know, what will happen in terms of other buildings. Well, you know, I think we've also got to think about things that haven't gone away. You know, what we can do as a creative industry is really think about how we can design places which will still create the makers of the future. And I think it's a time for us to really kind of consider what the future of our creative industry looks like. I think we've kind of seen a huge drop in design and technology uptake at schools, and I can only imagine with the schooling from home, that's got even potentially worse. But we have seen a huge spike in online gaming, for instance, and I'm interested to see how architecture and the design and the fashion industry adapts to the future. But really, if we, you know, Boller Lane we've just submitted as a planning application, that's got a series of maker spaces on the ground floor. And really, I think we've got to think about the high streets and how maybe it's the future. It doesn't have to be just retail, but give real talent an opportunity to kind of showcase their making and really give opportunities for more people to get within the creative industry. In terms of retail, obviously, there has been a local focus, and I think I think a lot of that is great, and I'd be interested to see how that is backed up when we go back to work and how we kind of move away from our local sometime. You know, our high streets are suffering, and I think we need to really kind of take a grip of what the high streets can offer and really rethink that approach. And then look at some of the other buildings. You know, we think about buildings that we've got on the drawing boards, but, you know, we've also got a large conservation team, and we've got existing building stock and a lot of London's cultural assets that we're working on. How do we adapt these buildings to kind of cope with what is really interesting and challenging times?
And you've had quite a lot of experience in your career of working on medical buildings as well. And what have you learned from that experience that you can bring to your design work today?
Well, I think I mean, you know, working on healthcare buildings for me is kind of one of the most valuable things we can do. And as we've seen, you know, the NHS are a hugely cherished part of the UK society. Not only the largest employer, but I think one thing I'd like to see change within that industry is the kind of the bidding process. I think there's a lot of waste within the hospital design process. for the last 15 years, we've seen competitive dialogue get, to a point where it's a bit unsustainable. But looking at how quickly a Nightingale Award, for example, can get up and in essence have the spirit of getting the job done and working towards a common goal, I think is things that we can all learn from. Ultimately a general hospital is going to be very complex and there's a public interface in many wards and departments. And I think we've really got to kind of rethink the way we look at buildings is maybe it's more multiple use and adaptable, and think about that long-term kind of goal that we want the building to do. We can't necessarily predict the future, right? But what we can do is create buildings which will allow change to naturally happen. I think some of the interesting things that's happened within the healthcare just during this period, which could maybe change things, is the digital first primary care. That's kind of a movement to try and get more people to kind of have online assessments, kind of reducing the impact of GPs. And there's the 25% target they're looking for to basically people to go to there first. You've got to remember GPs have around about 300 million consultations a year. So, before COVID-19, only 1% of them were online. And I think what we've seen since COVID-19 is a huge uptake in online consultations. I think it's up to 50, 60%. What that tells me is people are getting more confident with doing things online. And I think that's the tipping point. It's getting people to be confident about doing stuff. So, we're seeing this kind of shift just because of COVID-19, but ultimately, we've got to learn from some of the things we've done previously. And healthcare is one of the clear kind of leading examples of where they've had to deal with similar things in the past, right? So I remember back in my Anston and Allen days when we designed Pembury Hospital, that was the first hospital to be 100% single bedroom. That was a response in time to the MRSA superbug outbreak. And really kind of separating patients out was to minimize kind of the transfer of any diseases. What we managed to do in that hospital is to naturally ventilate all the patient rooms. The problems that occur with that solution is some of the patients feel isolated. So they feel like they're not necessarily being kind of looked in the same way or looked at, or they're out of sight, out of mind. Obviously they're not, it's just a perception. And so I think what we've really got to do is got to think about, how we can learn from some of the environments within healthcare, but not to make our environments feel sterile or feel cold. I think that's going to be the worst thing to do, is to design spaces which go to the extremes of cove skirting, of kind of laminations and a lack of natural materials. I think we've really got to kind of look at what we can do as a design industry to still make sure that we can easily find spaces which transfer of diseases is minimized, but not go down the route that everything has to be clinicalized.
Yes. So one last question. Do you have a large R&D section in HOK? Because I've noticed that the Chancellor of the Exchequer, when he was talking on the 5 o'clock briefing a couple of days ago, was saying that innovation is going to be one of the things which will take us out of this crisis. And architects, particularly if they've got a bit of time on their hands, actually should be great at delivering innovative ideas of how we deliver a better environment in the future. Right. Is that something you can see firms like HOK really being able to deliver change to?
Yeah, I mean, Peter, we feel we're part of the world design community, and we're spread across many offices. But in London, I think we've all put our hands up and said, how can we help within this situation? And when you're in your own home, and there's not much you can do, but one thing we realized is we have things which can help. So 3D printers, and many architects rallied up and answered the call and selfishly just went and started printing. And I think that just shows great entrepreneurship and great commitment to the cause. We've then developed that with the RIBA and HTA to try and work out how we can be more effective getting this PPE to the front line. So we created a website, which is theindustryprints.co.uk, backed by the RIBA, to really try and think of a way to standardize what we're doing, but also getting a process to tap into the NHS supply chain to get that into the front line as quickly as possible. And so we've got that running. It's obviously, it's all at our own cost, but it's something that we really see as a benefit for a design community. And I'm interested in seeing how we can then use that community spirit going on. You know, what you talk about innovation, and I think innovation happens when you don't try to keep all the secrets to yourself, right, for competitive advantage. It's a really tricky line to take, because, you know, that's unfortunately to win projects, you've sometimes got to show a differentiator. But I do think we've got a community of architects and designers that really want to find the best answer. And I think the more opportunities that we can have to work together, I think we're all going to benefit from that. So I look forward to seeing what we can do, but really kind of love the spirit of HTA and Foster's and everyone that's made that work. So hopefully we can make a good effort for the NHS there.
Very good. Well, David Weatherhead, thank you very much for your contribution. I think you're absolutely right. If we can keep this collaborative feeling we have during the COVID crisis, that can carry on afterwards, then it will be for the benefit of us all and for society in general. So thank you very much indeed.
Thank you, Peter. Thanks for the time.